So the challenge in the field of MGUS and smoldering myeloma is to identify patients who will progress before they do. And we have pretty good clinical risk stratification models that look at bone marrow infiltration, that look at M-spike levels and free light chain ratios to do exactly that. And I do want to highlight the most recent iteration of the MWG model as well, which makes use of cytogenetics, and I think it's an important step forward. And then in recent years, groups, including ours, have shown that genomics, DNA sequencing of tumor cells, can actually further improve risk stratification. But there's less data on, the patient's immune system, although we have proof that it matters. So what we did here is we put together the largest single-cell RNA and TCR sequencing cohort of both bone marrow and peripheral blood immune cells from patients with MGUS and smoldering multiple myeloma to ask some big questions. And I think one of the biggest questions is what happens with patients with MGUS. Do they look like smoldering myeloma? Do they look like healthy individuals? And so we actually found that there are significant changes in immune cell composition in patients with MGUS. And in fact, they're more similar to patients with smoldering myeloma than they are to healthy donors, which of course seems to suggest that changes in immune cell composition are established early, and that it is changes in immune cell phenotype, functionality, and clonality that may matter more for progression. And so indeed, we showed that cytotoxic T cells progressively acquire more of an effector phenotype. They clonally expand. They show increased expression of senescence markers, decreased expression of cytolytic markers, suggesting that their functionality progressively decreases over time, which is also in line with data from early functional studies by Madhav Dodapkar's group. And we also showed that malignant plasma cells are more likely to interact with these coenzyme K expressing cytotoxic T cells, which we showed before are, source of exhaustion in patient bone marrow and maybe a key player. So the plot thickens, so to speak. And lastly, we showed that if you compare the bone marrow immune microenvironment between patients with smoldering myeloma and patients with asymptomatic Waldenstrom's, which is another type of bone marrow lymphoma, B-cell malignancy, we find that increases in Tregs, Th17 cells, naive CD4 positive T cells may be characteristic of smoldering myeloma, as they're not observed as much in Waldenstrom's. And the same is true for the downregulation of CEBPD in myeloid cells. So overall, we think that this study has the potential to answer big questions regarding the role and importance of immune dysregulation, both in myelomagenesis, the really early stages, but also in disease progression, and therefore inform a lot of future studies that may help, one, improve risk stratification for our patients, and two, potentially even help develop new immunotherapies.